What is the state of America's health?
This is a really good question. We are living in a dual pandemic. Talking about the incidence of heart disease, the prevalence, the mortality that we've had from cardiac disease, that's been the number one killer of Americans since 1918, when we had another pandemic, the Spanish flu epidemic that took it out. For 1 year, it was out as the number one cause. We have been struggling with this ever since. It has to do with our lifestyle. And never a finer point was put on it than to look at the data that says that it had, before COVID, heart disease had become the leading killer in most countries, the low and middle income countries, but the high income countries, had fallen to number 2, except the United States of America. So we could have all of the resources in the world and still have heart disease as a blight on this society. We have a situation where Medicare is going broke. It was supposed to actually become insolvent in 2026. It's now scheduled with COVID to become insolvent in 2024. And that's going to mean a large change in the way we redistribute resources, or large cuts. They've estimated 30% cuts to physician fees. That will make the system crash. And so the question that we have to answer is, what can we as individual Americans do about this? How much responsibility can we take for our own health, follow healthy principles and lifestyles that would cut our rates of disease and cut our healthcare expenditure? And we have a choice. We can go ahead and do, the way we've been doing our lives, and continue to suffer, because this system that we have is really good at stopping people from dying. Stopping people from getting ill is still a problem. So we have a choice. We have a fork in the road. And that fork is either going to be a healthy plate or one that isn't.
How do we solve America's healthcare crisis?
The most important thing that we could do is look at all the data on lifestyle. This healthcare crisis is essentially a self-inflicted wound on the American people. Sure, there are diseases that are genetic. There are some that are environmental that we didn't know how to avoid, but there are many that are actually due to our active lifestyles, that every day, the choices that we make. We get up in the morning and we decide that we're going to exercise or not, and how much and how. And we get up in the morning and we decide what we're going to eat. And if we just take a careful look at the health literature that supports plant-based nutrition, exercising daily, maintaining a healthy weight, not smoking, making sure that you know what your blood sugar, blood cholesterol, blood pressure are like. If we do all of these things, we can actually solve this healthcare crisis. One of the most striking graphs I've ever seen is the comparison of around the world, comparison of life expectancy versus healthcare expenditure. You've got to see this graph where all the countries are doing pretty well and spending much, much less than what we spend. The United States is sitting alone and in one part of the graph with massive expenditures and poor outcomes. Is it because we don't have good care? Certainly not. If you go on the Johns Hopkins website, take a look at the COVID numbers, which are right there for everyone to see. You can see the number of COVID cases in the United States is absolutely massive. And Western Europe is not doing so well either, but it's absolutely massive in the United States. And then you move over from the incidence of COVID to the case fatality rate, and you will be shocked that the case fatality rate in the United States is incredibly low compared to the rest of the world. So yeah, you're going to get COVID, highly likely at the United States, but dying from it, you better be in the United States if you want to survive it. Well, that's because we have an amazing healthcare system. So why don't we have the life expectancy? It's because there are so many choices that people make every day that are so detrimental to their health. And even living in the best situation, all the king's horses and all the king's men can't put people back together again. So I'm hoping that everyone will recognize that and make the choices that are going to be positive for them, for their family, their community, and the nation. And I think it's everyone's patriotic duty to do that.
What are your thoughts on this passage from Gary Taubes, author of The Case for Keto? The big difference between the physicians and researchers who admitted to using keto 20 years ago for temporary weight loss and those eating and prescribing keto today is that the latter now believe these diets are the healthiest way for them and their patients to eat. They don't worry about the saturated fat their patients will be eating because the clinical trials confirm this way of eating is beneficial, and they can see their patients and themselves getting healthier, often over the course of weeks or a few months. They are loath to recommend anything else. I've interviewed more than 120 of these physicians who tell me that they chose medicine as a career because they wanted to make their patients healthy, not to manage chronic disease. Getting their patients off carb-rich foods, at the very least, sugars, grains, and starches, and eating something akin to keto makes that happen. When public health authorities argue that a healthy diet for all means plants, they make the job of these physicians and the challenge to their patients that much harder. Again, what are your thoughts on that passage from Gary Taubes?
So let me take it in reverse order. So healthy diet, meaning mostly plants, I wasn't aware that we had that many effective public health authorities actually saying that. I mean, yes, we have guidelines from the American Heart Association, American College of Cardiology. We have the dietary guidelines for Americans. And we were hoping that there would be a large push towards plant-based nutrition. And maybe it's because I'm on the other side of what Gary Taubes is saying. I see it as very slow in terms of the uptake. Now let me go back and deal with many of the things that he's actually said. And so one that everyone should hear from this passage and everyone should pay attention to is sugars. But when you say grains, you've got to separate the poison from the benefit, and that is refined grains, which are clearly detrimental to human health. And there was a wonderful article from the Pure Trials, which covers so many countries, around 21 countries. They published a while back that carbohydrates were bad for you, and fat was, particularly if it's unsaturated fat, was relatively good for you. Great. The problem with it, if you looked in their methods, they were talking about refined grains. We're talking white sugar, white rice, and white flour. And if you're talking about those kinds of grains, then yes, it is very detrimental to your health, as opposed to whole grains, where every trial that's looked at whole grains has shown a reduction in mortality. And that's really what we're talking about. So when we go back and talk about, what physicians are prescribing, I wish that would be a gold standard, but physicians are a product of their education and their environment, and the leading cause of death of physicians is still heart disease. And so even though we know pretty well how to avoid heart disease, we're still succumbing to it ourselves. And so the most important part of this discussion is that there are benefits to a keto diet. Those benefits are actually not detrimental to people long-term if they're doing it with plants. That was shown by an article published in 2018 in Lancet Public Health. And the rest of the literature is very clear that if you're doing a keto diet for any length of time, you are increasing your inflammatory markers and your cholesterol. And those outweigh the benefits of losing weight, decreasing the blood pressure some, decreasing diabetes a lot. Those benefits are outweighed and the mortality rate goes up. Now, each article that has looked at this, which is about 8 of them at this point, all of them saying the same thing, are very clear. It takes a while for doubling or tripling your LDL cholesterol, the bad cholesterol, to actually take its effect. And so people may feel better. They're actually going to feel more energetic when they lose the weight. They'll think that things are going really well while their arteries are being plugged with the LDL cholesterol. And so that is why the Greek study said it was 31%. The Japanese study said it was 22%. one in the Journal American Heart Association, in people who had had prior heart attacks doing keto said 53% increase in death rate. And so this is not a diet that people should be doing for any long length of time. How long is it safe? I think most of us would say that if it's going to be detrimental, don't do it at all. But there may actually be a point at which you could sort of optimize between it, do all of this keto type of dieting for a month or two, lose some weight, get started, and then switch back to plant-based diet. The other way to do it is actually to do a plant-based keto diet, which has never been shown to be of harm. So I would say that the good point would be if we're going to have a conversation about refined grains, that's the one that I think pretty much everyone can agree on, no matter what your point of view is. These are things to be avoided, but eating animal products and saturated fat for long-term will have negative health benefits.
Can you completely prevent heart attacks and strokes through diet and lifestyle?
We have to recognize that there are some genetic abnormalities. People who have heterozygous familial hyperlipidemia, that is, their cholesterol is really high, it's genetic, they have one of those bad genes, they are going to occur with 1 out of every 250 or 500 people. And they are going to have a very, very high cholesterol, typically an LDL cholesterol greater than 190. And those folks, if they aren't really upfront and addressing this genetic abnormality, they could have, even with a healthy lifestyle, they could have a heart attack or a stroke from blocking their arteries with cholesterol. And so it isn't exactly true to say that you can completely prevent heart attacks and strokes. However, for the vast majority of us, those of us who are not, should we say, well, we're all mutants. If everybody has mutations genetically that occur, and we're all a little different. But for the most part, we actually can avoid our heart attacks and strokes by keeping the blood pressure down, by making sure that we're not overweight, diabetic, making sure that the cholesterol is low, that you're doing a plant-based diet, that you're exercising somewhere between 150 and 300 minutes per week, and not smoking. Now, there are other negative things, such as the data on smoking marijuana. It's been legalized in so many places, including the state of Illinois. I would just ask the state legislature in every place to just put the words into their search engine, marijuana, stroke, and they'll see that it's one of the leading causes of stroke in younger people. Cocaine would be another one for causing heart attacks, and that's obviously more famous because of basketball players who died suddenly doing cocaine, and it's a real issue. So there are issues other than diet and exercise that people do that can cause heart attacks and strokes. But if we were to avoid substances, substance abuse, do a healthy diet, and have an exercising lifestyle, we really should be able to reduce, if not eliminate, the majority of our heart attacks and strokes.
Do we need some dairy products to stay healthy? Do you recommend plant-based milks like oat, hemp, soy, coconut, almond, cashew, flax, etc.?
So I know I would disagree. There's some people who would say that no one needs any dairy product at any point. Well, if you think of milk as a dairy product from this, regardless of which animal it comes from, then we were all pre-programmed to have our own species dairy products. Okay, and the need for that goes down with age. People who have looked at it carefully understand that when there are very few times in our planet that one species of animal will take the milk from another species of animal. Humans do this, and it's very much to the detriment, mostly because of the saturated fat, the cholesterol. The lactose causes some gastrointestinal disturbances in many people, but I would say one of the more concerning issues would actually be the growth hormone. And that growth hormone excess makes people bigger, and it makes you bigger in places that you really don't want to be. And so when we're talking about cow's milk, the ability to take a baby cow and turn it into a 1,500-pound animal pretty quick is something that milk is capable of doing, and that's not something that we should be doing for ourselves. So but to answer the question directly, when you look at long-term food frequency questionnaires and compare it to death rate and the cause of death, all-cause mortality, cardiovascular, cancer, what you find is that dairy in most of these studies are actually detrimental. It may not be as detrimental as eating red meat, eggs, or processed red meat, but it's still detrimental. And so something that people should try as much as they can to replace those milks with, the types of milks that have less in terms of saturated fat and cholesterol, and those are the oat milk and almond milk and soy milk and the like.
Do you recommend statin drugs? Some have said statins contribute to diabetes. Do you agree?
I would say that statins contribute to diabetes. Absolutely. That's been very clearly shown. It also has been shown that it actually can decrease the death rate in the diabetics so much that it seems like a risk benefit that you would never want to accept. But let's look at that data very carefully, okay? It turns out that it's the highest dose of statins, and interestingly enough, we do recommend the highest dose of statins that people can get their hands on for most of the conditions that actually need a statin, because the outcomes are better. That is, the high dose is better than the moderate better than the low dose, and low dose better than none. And those studies, people can just look at that again through a search engine, put in statin mortality, you'll be shocked. And if you are at risk for a cardiovascular event that's preventable, you should go and be on a statin if your doctor says so. Now, the fact of the matter is the diabetes that happens that's statin induced tends to happen in people who are about to end up diabetic anyway. That is so-called metabolic syndrome, typically centrally obese. Have I seen the blood sugar go up in people who are thin and otherwise healthy? Yes, but you never quite to a diabetic level in those folks. So if you're taking care of your lifestyle and you are actually thin around the middle, this isn't much of a risk and you have the benefit. Now, what's our other big risk of statins, to be honest, is breaking the Medicare trust fund. So this is a very tenuous situation. You could not have done a lifetime life expectancy calculation back in the 1980s, funding the Medicare system in the 60s and account for statins. Statins don't cure anyone, and it lengthens their life significantly. So if you're the payer, that's your worst financial nightmare. That is something that will not let someone come off of the rolls because they died, and yet they're still ill and taking up resources. That's what our Medicare system is for. I worked for Medicare for 4 years. They don't look at it that way. They look at it as an opportunity to help the population. They take it very seriously, but statins are really making them struggle. And when people say they're not going to do statins, I kind of tease them saying, so you're trying to do the government a favor. Because there are so many conditions where if people would just look up, stroke, heart attack, and look at the difference in outcome with and without statin, the differences are very striking. Now, can you replace that completely with a plant-based diet? Because that's really what's underlying this question. That is, what can you do instead of statins to lower your cholesterol, lower your inflammation, which is the main effect of statins? If your LDL and your C-reactive protein go down, aren't you in a better state? And yes, you are. Can you do that with diet? Absolutely. Is it enough? Well, in some people it is, but if you're talking about someone who has multivessel coronary disease, that triple bypass surgery, that sort of thing, you're going to need all hands on deck. And so you should be doing a whole food plant-based diet, an exercise program, and all of the medications that the doctors actually are recommending for you to give you your best outcome.
Do you recommend bariatric surgery?
It's interesting that bariatric surgery does have beneficial cardiovascular effects. Wouldn't it be nice if everyone followed Dr. Garth Davis? He's a Texas-based bariatric surgeon who has written books on plant-based nutrition and spends the majority of his practice, as I understand it, trying to talk people out of the very surgery that from which he makes his living. And why does he do that? Because he knows that this is actually better for people. Every surgery has some complication. Every surgery is going to have its side effects, even when it's successful. And I remember the original bariatric surgery, which people have improved dramatically, the ileal bypass surgery, where people would have 20 bowel movements a day, and they would just, pray to have the surgery taken down so they can go back to a regular lifestyle. Well, one of the best ways of dealing with this is to start with healthy lifestyle at a young age and never get to the point where you have the so-called morbid obesity that would require bariatric surgery. The best part of bariatric surgery would actually be prevention.
How do you prevent diabetes?
There's interesting data published a couple of years ago about preventing diabetes through plant-based nutrition. And there was actually a linear relationship between the amount of plant-based diet and prevention of diabetes, as the incidence goes down, as the plants go up. Now, what is the cause of that? Is there something magic that lowers your blood sugar when you're eating plants? Well, yeah, the magic is actually in the fiber. That modulates the absorption of nutrients and gets your insulin levels to sort of flatten out a bit so that you don't have that insulin being an amazing growth hormone. You're going to have less central obesity, less inflammation, and less plaque. And so if people are doing a low enough calorie diet so that they're not gaining weight, and they're doing a good job of a high fiber diet, diabetes really should be preventable.
How do you prevent erectile dysfunction?
So if people look at the modern commercial zone, you'll see a lot of data on or advertisements for ultrasound techniques or sound wave techniques that will actually break up plaque. And so you're hearing this on the radio, you're seeing it on television, and people are finally understanding that erectile dysfunction is largely plaque formation in small arteries. And so people say, oh, it's the canary in the coal mine to let you know that you have heart disease. And it's just because the arteries are smaller. And so this information is actually good to get out to the public. I don't know, but efficacy of the idea of doing these sound wave treatments, but I can tell you that at least people understand that this is a blood vessel issue and you've got to protect your blood vessels. And so prevention would be nutrition, making sure that the plaque is not developing. And if people are able to do that, they should be able to maintain their erectile function long-term.
Of all the people you've advised over the last 10 years who followed your advice, what were the results and what percent got to their optimal blood sugar, blood pressure, and weight? What percent reversed major health issues, and what percent didn't get the expected results?
So that's an interesting, that's an interesting question. I would say that I can only give you my impression, and some days are better than others. First of all, as background, as a cardiologist and preventive cardiologist, but I've covered the coronary care unit, and I take people once I see them as an inpatient. I can say that over the years, my style has changed. Over the last couple of years, I've been very particular about starting the diet early, as many have. And it's really a conversation that I have since I'm not the interventionalist. It's someone that's usually come in with a heart attack, gone to the cath lab. An interventional cardiologist has actually put in a stent, and they put the patient in the coronary care unit, and I'm doing rounds with the house staff, interns and residents the next morning. And so I will have a good conversation with them. I typically tell them, I want to have just a little bit of your time. I'm going to ask you some questions that seem like the silliest questions you've ever heard. But if you just put up with me for a couple minutes, we'll get through it and you'll understand why I'm saying it. And usually the patient says, that's okay. And so we start. Say, just tell me in your own words why it is that you came in, that you ended up in the CCU under my care. And they say, oh, I had a heart attack. I say, okay, that's right. And so what does that heart attack really mean? And what happened to your heart? Well, they said I had a blocked artery. That's correct. And what was it blocked with? Oh, plaque? That's correct. And what is plaque made out of? There's usually a little pause, but almost everyone, regardless of their level of health literacy, can say cholesterol and fat. That's right, cholesterol and fat. And where did the cholesterol and fat come from? And 100% of people will say, I ate it. So that's my opportunity. So I tell people, okay, I'm going to put you on a plant-based diet, no more cholesterol and fat. Unless you really want to, we can change your diet back to a regular diet and then we make more money. And that gets a laugh out of 100% of people, but it's true. And so I would say that my practice is sort of, it's morphed over the years. I have many more tools than I used to have to try to get people to be on a plant-based diet. And if you give them the tools, you give them your time, and you have a team of people who can support them, then you're going to get much more in the way of success. So I've got motivated patients because they've had an event. And so I'm not sure that every doctor is going to have the same results that I'm going to have. And I would say over the last 10 years, I have changed so much that it's hard to even compare with what I'm able to do to change people's outcomes now versus 10 years ago.
Should we eat whole food plant-based fats like raw seeds, raw nuts, raw olives, and avocados, or should we limit them?
So this is an interesting question that cuts to the heart of sort of the vegan food wars that we were seeing back a year or so ago. There are many different camps within the plant-based community. My advice to them all as a journal editor, the journal editor for the International Journal of Disease Reversal and Prevention. My advice is that, we have bigger fish to fry without the frying. That is, we should be pushing our plant-based nutrition. And I try to remind everyone who gets into these arguments that the reason you have people who are no oil or people who are no nuts or people who are saying that you must have them and they all are really dedicated to them is because they've seen success with their particular brand. Well, it's interesting that the reason they have success is because there's plants. So I would say that maybe this isn't the most important question, that we've got some bigger ones that we should be trying to deal with. But if you look very carefully at the literature, the type of food items that are in this question all have a lot of monounsaturated and polyunsaturated fat. And so should we limit them? Yes, we should if we're overweight. As people like to say, if the fat you eat is the fat you wear and you are overweight, then you really should be limiting them. In terms of cholesterol, as a cardiologist, they're actually all very good. I would say that there are people who say that you shouldn't eat nuts. There's a publication from one of my co-workers in nutrition at Rush University that said that in their randomized trial, all species of nuts lowered the weight. The mechanism is actually very interesting, and it may not apply to everyone. And when you look at the standard deviation, there are people very definitely who shouldn't eat nuts because it raises their weight. But on average, the weights go down, with one exception, and that's peanut butter. And that is, it probably is important to have the chewing mechanism with the salivary digestion and enzymes. And if you do that, the nuts tend to decrease your appetite. And so that data isn't actually widely known, and it certainly wasn't known when a lot of my friends were making no nut diets. And so I think we all have to be interested in, and which I think they all are, in the latest in terms of randomized trials, which would support the use of nuts for weight loss.
Should we take fish oil to get enough omega-3s?
So fish oil is one of those areas in medicine and cardiology where it's hard to imagine, and there are a handful of them. Fish oil isn't the only one. I would list efforts to raise HDL cholesterol, where we were just misguided. Small trials, and the small trials with so-called publication bias. That is, I'm a journal editor. When somebody sends in an article, original science, and it's earth-shattering because it's strongly positive about some therapy or some nutritional intervention, I'm excited about publishing it. If the reviewers come back positive, we're going to publish it. Well, suppose someone had done like 19 of those studies that were negative, and then the 20th one, which for the statisticians in the group, that would be a p-value of 0.05, and that one is positive and the other 19 are negative. The other 19 might get rejected from a journal, but they're probably not even going to be put into a journal. So we have to be aware that there is such a thing as positive publication bias. And that really does color a lot of the things that we should be doing. And omega-3s falls into that category. There were multiple small trials saying that it would improve your cognition or prevent dementia, that it would decrease heart attack, it would decrease atrial fibrillation, it would decrease ventricular rhythm disturbances, all these technical issues of the heart and the cardiovascular system that large randomized trials failed to show. With one exception, which really is worth mentioning, there was one relatively new omega-3 compilation out there where they separate the DHA and the EPA. The EPA was actually shown to be significantly positive in people who are at risk and have had a recent cardiac event. It was actually just as good as a statin, about a 24-25% decrease in cardiac events. And it was even on top of statins. So it was really kind of earth-shattering. And it got into all of our guidelines and people were using it. And then at the last European Society of Cardiology meeting, last European Society and American Heart Association meeting, there were very large prospective randomized negative trials on omega-3s showing that they did not help at all. And people were asked, well, what's the difference between your study and the EPA's trials? And the answer came back, it's mineral oil. That is, that EPA trial actually compared the omega-3 formulation to mineral oil, and the mineral oil actually is bad for the cholesterol and bad for cardiac events. And so it wasn't just a placebo, which the newer trials were comparing to corn oil. They were actually comparing to something that was damaging. Therefore, the 24-25% decrease in events was actually versus something that was harmful. So that really took the wind out of the sails, probably SALES as well as SAILS. And I would think that we have no basis at this point for giving artificial or synthesized or any omega-3 trials. But we look forward to it because we've been at this for a while, and I imagine that there are still some that are ongoing, and that people will actually get some benefit if they have extremely high triglycerides. It's very effective at that. But other than that, for the general population, for the general patient with heart disease, we don't have data right now to support omega-3 use.
Should we try to avoid or add salt in our diet? How big a problem is salt? What health problems does it cause? And why do some people say we need salt?
It's a very interesting area if you have congestive heart failure. We all tell our patients to do a sodium-restricted diet because if their heart is failing, their kidneys are backed up, they're not going to be able to get rid of this, and their legs swell up. the interesting part of that is that there are several trials, one of them from Rush and Stroger Hospital with Rami Dukhi as the first author, showing that sodium-restricted diet is associated with higher mortality. So there are some people who say we need salt because of that data. But if you don't have heart failure, by the way, the guidelines are still to sodium restrict heart failure patients and avoid the hospitalization and all those complications. But if you don't have heart failure, we have to recognize that many people can get away with large amounts of salt. And in the PURE trials, that I think this was one of their 19 country studies, they said the best outcome was at about 4,000 to 5,000 milligrams per day. That generated a wonderful argument between the World Heart Federation and the American Heart Association, who was saying, no more than 1,500. And it was interesting to see the data going back and forth. But I can say a couple of things. One is that there are people, particularly our African-American population, who are salt sensitive, but there are loads of salt sensitive people who are not Black people. And so you need to know whether you're one of them. I'm certainly one of them. If I ate sodium, my blood pressure would be 125. And if I don't eat sodium, my blood pressure is 104. And we see that repeated over and over again. So yes, I do avoid sodium. I actually use potassium instead, and that's safe for anyone who does not have severe chronic kidney disease. But ultimately, the volume expansion that's associated with sodium intake isn't good. So our American College of Cardiology, American Heart Association guidelines would say no more than 1,500 milligrams of sodium per day.
Tell us about the articles from JAMA about the difference in health outcomes from people who consume plant versus animal protein.
That's an interesting set of articles. There are three of them. One in 2016 from the Nurses Health Professional Follow-Up Study that's done at Harvard. In 2019, there was one from Japan. And in 2020, just like last July or so, there was a third one from the NIH-AARP. And they were actually very carefully showing what would happen if you take, in these large 30-year outcome trials, you take animal protein. For every 3% that you replace with vegetable protein, what would happen to mortality? And they were all very carefully analyzed and were very congruent between the three different studies done in three different locations, three completely different populations, showing that plant versus animal saves lives. And so obviously, when you say 3%, and you're going to decrease your death rate, your overall mortality by 34%, which is what happened if you replace processed red meat with vegetable protein. Well, you could say that, if you do that only 3%, that's great. But if you do 100%, that would be even better. Well, you may not be able to extrapolate by like that, but those studies are very clear that the less you do in terms of animal products, the better off you are. There was only one exception to that, and that was the all-cause mortality with dairy was actually 7% better in the Japanese study. But for all the rest of them, and including the Japanese study for cardiovascular disease, dairy was damaging. For cancer mortality, dairy was damaging and should be replaced by plant-based substitutes. On the other hand, if the overall all-cause mortality data shows something different, there's something different about that population that I can't explain just looking at their data. People who drink milk in Japan wear their seatbelts more, but it certainly wasn't cardiovascular benefit and it wasn't cancer benefit.
What about eggs? Are they healthy? What about egg whites?
So we've actually had two very, very large trials that have come out in the last couple of years, talking specifically about eggs and mortality, that there's a linear increase in mortality with egg consumption, that the only safe amount of eggs is less than a half an egg per day. And if you take those data sets and you actually model them for cholesterol intake, which is a fancy scientific way of saying eat egg whites instead because there's no cholesterol in the egg whites, it turns out that the mortality issue goes away. And so there may be some problems with eating egg whites in terms of how chickens are abused or how the animal protein increases IGF-1 and, is it going to create some cancers? There may be some egg white issues, but they aren't cardiovascular. Eggs are very unhealthy, particularly for the cardiovascular system, and egg whites, at least statistically, do get a pass in that regard.
What are the major problems with eating animal products?
This is an area that had new data come out in just the last 6 weeks. We have known since about 2012 from the Cleveland Clinic that when you eat animal products, you can get a substance in your bloodstream called TMAO, trimethylamine N oxide. And before that, we were really focused on saturated fat, the fact that a lot of the meat would be fried or charred, and all of which have negative health effects. The fact that it increases serum cholesterol, all those were the concerns that we had about eating animal products. But then the Cleveland Clinic pointed out that as you eat the components of animal protein, and you're eating, that includes, for people who want to list the chemicals, betaine, creatine, phosphatidylcholine, and choline. Each of those contributes to the pathway for development of TMAO, trimethylamine N oxide. But the conversion actually happens in the GI tract. And so the Cleveland folks were trying to get us to pay a bit more attention to the bacteria in our gut. Well, years later now, we have so much more data on the microbiota, as it's called, the microbiome. That is, the microbes that are inside your gut control so many health effects that we were not aware of before. It turns out that they're associated with some major diseases, such as Parkinson's disease, if you have the wrong bacteria in your GI tract. And they actually do produce the inflammation that is associated with eating animal products. And the most interesting data from just a few weeks ago is that the severity of COVID illness is also related to how much of the bad bacteria you have that cause inflammation and cytokine storm. All of that is inside your GI tract. Most people don't realize that if you check the DNA of a human, it's not 100% human DNA. Actually, only about 46% apparently is actually human. The rest are all these microbes. And some of them are fungi and some are viruses, but there's mostly bacteria in the GI tract, and they control your health. So it's sort of a shocking area. We've been working on sort of the effect of it for decades, and we weren't really dealing much with the cause. And so a couple of things that we should say about the microbiota is that the GI tract bacteria are controlled by what we eat. And vegans have a very low amount of the bad bacteria, and meat eaters have a high amount of the bad bacteria. So if you could take a person who eats animal products, give them a steak and measure their TMAO level, it goes up. Measure their inflammation, it goes up. Cholesterol, sure. If you give that same steak to a vegan, they don't have the bacteria, at least not for the first few days. They don't have the bacteria that's going to have all the negative effects. So they don't get that TMAO rise, for example. Now, why is that important now? Because the issue of COVID and dying of COVID, we don't see a lot of, and I would love to, if anyone, has a bunch of cases of vegans dying of COVID, I would love to see it. I, have only a few hundred that I know, and they have gotten COVID and not developed a serious illness. I don't know of actually any who were actually admitted to the hospital, certainly not ventilated or died. And it has to do with the microbiome, according to the publication from a few weeks ago. So plant-based nutrition, it was timely before, but it's even more timely now. And so I'm trying to tell everyone, go vegan for COVID, hashtag, but I'm hoping that people will hear that message, that they need to, lose the weight, lower the cholesterol, lower the blood pressure, lower the blood sugar to avoid a bad outcome from COVID. And eating animal products is sending you in the wrong direction, not just because of its effect on those four things, but because of the microbiome that's responsible for the inflammatory response that destroys your health when you have COVID.
Taking that a step further, can you expand more on how to prevent a bad case of COVID? Does your weight, your blood pressure, cholesterol level, or blood sugar level make a difference?
Interestingly, we've been really hit hard, particularly in people of color. And a lot of that has to do with the, what people are calling structural racism. That is, if you, have a inheritance from, a previous generation that did well economically, and you have support to go to school, then you are actually going to do well. If you're in a community that doesn't have that to the same degree, they're not going to do as well. Okay, so how does that relate? Well, it turns out that the people of color in this country who have not had the economic advantages will have lower paying jobs. They have jobs where they have to show up to the chicken factory or risk losing their job, and then end up with a bunch of COVID cases and some even dying. And so that, when people say structural racism, we're not even talking about people's attitudes today. We're talking about how the communities are built and the population size and the number of people who are close together, and whether people can socially isolate, and do they actually have to go to work and face people who are going to, be abusive when you ask them on a bus and you're the bus driver to actually wear their mask. And so all of this becomes highlighted during the COVID era. And on top of that, we have people who have more cardiovascular disease and higher degrees of obesity. And so every study that's looked at it will tell you that being Black increases your mortality rate, but it's not because you're Black. It's not your race, it's your risk. And so if you adjust the model for all of the risk factors, you find out that every study shows about the same thing. At Rush, it was 21%. In New Orleans, it was 11%. There's a slight protection of being Black. So why are so many people dying? It's because of the risk factors. And so the best way to avoid a bad case of COVID is to start now, because we're not done with this pandemic. We need to decrease the weight, decrease the blood pressure, get the cholesterol down, and the blood sugar down. The way to do that is plant-based nutrition and exercise on a daily basis. I'm still leaving a lot of room for vaccination. People really argue a lot about vaccination because it's relatively unknown. We're walking into an area that we haven't seen before. And did it give me a little pause to get a messenger RNA vaccine? Maybe for a half a second, until I realized the bigger picture. Is my job, particularly as a vegan, to do everything I can to not get this illness. Why? It's not just for me, but it's so that I don't transmit it to everyone else. And with the microbiome of a vegan, the odds of me getting a serious case of COVID is fairly low. And there's a good possibility that I could have asymptomatic COVID because I'm a vegan and otherwise healthy. And if I'm spreading it around, not unwittingly, that isn't good for everyone else. So definitely you might find out that the vaccine has some real problem in 10 or 20 or 30 years. But I'm doing it right now to save my fellow people because we're in the middle of a pandemic. And so I would say that get the weight down, monitor the blood pressure, make sure get it to normal, cholesterol level, blood sugar, and vaccination. Those are the ways to prevent a bad case of COVID.
What is a food desert, and how can we help people who live near them?
This has been something that folks have talked about for so many years and decades, in fact, really talking about opportunities to try and help people who have food insecurity. It's actually an issue that is also made worse during the pandemic because and it maybe not as much in the United States, but it's definitely happening in the United States. But there are people on the continent of Africa who are dying in the thousands because their food security was based on production from other companies, other countries, and all of that, a lot of it got shut down because of COVID. And so, we talk about the social isolation, social distancing, and working from home, but there are indeed opportunities to feed people that we should all be taking advantage of, and realize that there are a lot of people who are in distress. So it's not just third world countries, it's happening on the south side of Chicago, and we are doing whatever we can to try and set up food banks and contribute to those food banks. And the food deserts that have been here before COVID, a lot of them have actually been taken care of with major corporations going into neighborhoods, and people don't have to get on the bus and go for 10 miles to get to a decent grocery store as much as they did in the past, because people have been talking about it. But food insecurity is happening all over the place, including in the United States.
What should I tell my friends when they ask me where I get my calcium from?
So it turns out that the concern about calcium has been overblown a bit. I would say the most important thing you can do is find your favorite vegetables. You just go on your search engine, put in vegetable sources of calcium, and you're going to see a variety of leafy green vegetables and the like, and you pick the ones that you like, and that's what you should do. My concern as a cardiologist is that there were publications going back about 5 years saying that if you are a woman and you're older and you're taking a calcium pill, that it increased heart attacks. And so we don't have great studies showing that they're perfectly safe. So I would still stick with the vegetable sources, not dairy, and certainly not the calcium supplements, unless you've really discussed that carefully with your doctor about the heart attack risk.
What's wrong with eating fish? Many people say it's healthy.
So fish is definitely healthy if you talk about relative health. That is, if that JAMA article that many people talk about, where it sort of risk stratifies each animal product. And this plays out in many, many data sets. That is, if you do this as what I would call a substitutionary benefit. What do I mean by that? If say somebody is going to force you to eat cyanide or arsenic, take the arsenic because you'll live longer. And I say that sort of tongue in cheek, but the fact of the matter is our fish actually does increase mortality. It's just so much less. Fish, dairy, poultry are less deadly than red meat. Red meat is less deadly than eggs, and eggs are less deadly than processed red meat. So if you have someone who is going to have bacon and eggs, and you decide, okay, well, one group is going to get both, one group is going to get the bacon only, and the other one's going to get eggs, well, the eggs is going to actually do better, even though it's very damaging. But it's not as damaging as the bacon. So in that regard, we do have randomized trials, speaking of fish, where you take the red meat and you decrease it or eliminate it and do mostly fish and a little bit of poultry with extra virgin olive oil or nuts. That's the so-called PREDIMED trial published in the New England Journal of Medicine, both in 2013 and 2018. And what was very clear is that you decrease heart attack, stroke, and death by about 30%. So what's the problem with fish then, if it's such a good substitute? And that is, if you look at that article, and I encourage everyone to look up the PREDIMED trial, what you'll see is that combined endpoint of heart attack, stroke, and death was actually an addition of no benefit on top of a big benefit in stroke. That is, people did not have less heart attacks. They did not have less cardiovascular death, and they didn't have less all-cause death. But they did have a reduction in stroke. So and I've had patients seriously look me in the eye and tell me, I don't mind dying, I don't mind having a heart attack, but anything to avoid a stroke. Well, if that's the attitude that you don't want to live longer, you just want to have a stroke, then the Mediterranean diet, according to that randomized trial, will actually be good for you.
Which nutritional supplements do you recommend that everyone take?
There are a lot of nutritional supplements out there, and the data supporting them is minimal. If you look on the labels, most of them will tell you that they've not been evaluated by the FDA, and they're not for reducing any disease. Well, the one exception to that would be B12, because everybody needs B12 in order to keep your neurologic and hematologic systems intact. And when you look at the data very carefully of where does the B12 come from? Well, it's actually bacteria in the soil. So you have three choices. You can eat the dirt, which I prefer not to do. You can eat an animal that ate the dirt, and based on everything we've been discussing, that would have some really negative outcomes. Or we can just take a supplement. And so that's the way I'm doing it. And I think most people should do the same. Do we spend a lot of money on supplements that are worthless? Yeah, it's about $21 billion annually on worthless supplements. And I would love to see some of those supplement companies who are taking a piece of that money and actually do randomized trials and see if they actually are helpful. And, there's a handful of them, such as berberine, bergamot, amla, which is Indian gooseberry. There are a handful of them that do have randomized trials showing improvement in cholesterol, specifically for those three. But what I'd like to see is that it reduces cholesterol and improves outcomes, and they don't have that kind of data. So I would say let's set a high standard for taking supplements and make sure that our over-the-counter markets are, used wisely, because you could take $21 billion and pay for all the schooling of poor people, and our society would be way better off.
Do you recommend eating the new vegan burgers and other similar burgers that are made from a variety of pea and similar proteins?
So I don't have much of a problem with the processing if you don't do anything terrible to it. And if you're putting salt or sodium more than 300 or 400 milligrams per serving, that's probably not good. If there's extra saturated fat, and you can get that mostly by including coconut oil, that probably is not a good thing. And of course, people are very concerned about heme iron, which some of the products actually have, and that makes it taste and look bloody. And that, obviously, we don't have a lot of heme iron experience from plants in terms of outcome studies. We do have it from animals, and the effects on the heart are actually not good in terms of increasing plaque formation and upsetting those plaques. Now, you could argue that nobody's really doing heme iron very much. I know you can get it at a nutrition store, that most people are doing heme iron in the setting of saturated fat, cholesterol, creatine, betaine, phosphatidylcholine, and choline, all the stuff that I've been talking about today. And that's true. We're not separating it out, but to the extent that the NIH-AARP trial was able to try to figure out what's so bad about meat, what correlates with mortality, they were saying it's heme iron, nitrates, and nitrites, which of course are components of processed meat. So I would say that please be very careful with the new vegan burgers. Take a look at what the components are, and the nutrition facts on the back will tell you if it's high in sodium, high in saturated fat, or if there's heme iron.
Does the USDA give healthy nutritional guidance?
I've actually been in meetings with the USDA. I find them very willing and able to listen. And if you make a good case, they will try to change the information that they're putting out. They do run a process every 5 years along with the Health and Human Services to try and give guidance to the American people. My concern about it is that they, just like I was able to go and meet with them and discuss my point of view and the point of view of the American College of Cardiology and Nutrition work group. Well, everyone else does it as well. And so if you live in a society with not just free speech, but financially motivated advertising, you're going to see some things that are not good for our system get into the USDA guidelines. And you'll see them on television commercials, and you'll see them pretty much everywhere. And if we could get everyone to stick to large randomized trials, number one, and the second level of evidence would be the large long-term prospective non-randomized data, and sort of use those for guiding our nutritional choices, I think we'd be better off. The USDA has a tough job, and some of it is, I feel, hurt by congressional subsidies that have been there for a long time. And I know the USDA is not happy about putting out a document saying, less refined grains and less processed meat and less sugar sweetened beverages, and then find out that that our congressional subsidies are actually promoting the production of those things.
From a health standpoint, should we try to add oils such as flax, hemp, and olive oil to our diets, or should we try to avoid it? If we do use it, should we avoid heating it up?
So it's interesting that heating even at high heat was said in the past to cause popping of double bonds. So for all the chemists in the audience, that means taking your unsaturated fat and making it more saturated. When I looked at the more recent trials, they say that pretty much isn't true. I mean, you could, particularly if you're using it below the smoke point. Now, having said that, are we really benefiting the blood vessels? Probably not if you're using them in these oils in large amounts. And so I would say, maybe minimizing them, or, if you don't have to avoid them, you certainly should decrease it to a small amount. And the high heat, I think the jury's still out on that, because I was shocked to find out that what I've been telling people about the fat becoming more saturated apparently doesn't have a chemical basis. So let's keep an open mind on that. And again, if you're overweight, just remember that any oil that you eat is likely to be stored. So let's be really careful with it.
How do we know if the benefits of a medical treatment or test outweigh the risks, and who should we listen to?
It's a really good question that people have to wrestle with. I've given some examples, such as, niacin, which we thought of as something that was so benign, it's just a vitamin, it's going to help people. Great. It turns out large doses of niacin that were supposed to increase our HDL cholesterol, the happy cholesterol, the healthy cholesterol. It turns out that large randomized trials showed that they increase mortality. And we were kind of shocked. And then we realized that HDL itself, two large trials, the CAN-HEART from Canada and Copenhagen, both said that we had it wrong for 60 years. A very high HDL cholesterol does not protect you. It actually increases heart attacks. And so to whom should we listen? We have to keep an open mind. We have to drop our ego at the door. We have to not be dogmatic, because half of the things that I learned in medical school actually aren't true anymore, because we have better evidence. We start off with individual experience, and then you have a small trial here and there. But all of those can be overturned and change our guidelines because of large-scale randomized trials, which we don't quite have enough of. And so in the guideline business, in the clinical practice business, your own personal health, you try to use the best evidence that you can come up with. And the guidelines that we put out for prevention, for example, 2019 American College of Cardiology prevention guidelines are there for everybody to read. And you'll read a nutrition section that says that people should be doing mostly plants. And there's a nice section with references and talking about the strength of the evidence to support that. So I would say that the jury is always out. Medical knowledge increases or doubles every couple of years. And so sometimes that increase in knowledge is undoing things that we thought were true that just were not. And so let's just be humble and open-minded.
Why was it important for you to come back and speak here at the Real Truth About Health conference?
Really happy to participate. The major issue that I see facing Americans is that we have nutritional deficits in our brain. They're ingrained from society and our African American community. It's inherited from even our slave days, and people talk about trying to get away from the kinds of things that were for survival in the past, and now they're decreasing our longevity. But it's not just about our minority communities, it's about our entire system, because we have to take a stand for nutrition. We need to make sure that everyone understands the benefits of our medical system and the deficits. It's very expensive. We're constantly putting out fires that shouldn't have been started, mopping up the floor, as people say, instead of turning off the faucet. And we need to be incentivizing prevention. And sure, I'll keep talking about that with Medicare and with our government agencies, but at some point we have to take individual responsibility. I know that people didn't generally wear seatbelts until they were legislated, and click it or ticket makes a difference. And maybe that's what we need in terms of nutrition and exercise. But at some point, people would, if you want your personal freedom, you have to make sure that you as an individual are actually doing the things that are beneficial to your health. And so I know I've said it many times, and I'll keep going with it, that it's not just for you. That is, I don't, excuse me, I don't know too many patients. I have a few, but not too many patients who are so isolated that their health does not affect someone else. And so I feel like it's my personal duty to my kids and my family to make sure that I'm healthy and not a burden to them. I don't want them to have to take off of work seeing their patients to take me to a hospital. I think that would be, if it's due to choices that I've made, then those are selfish and uninformed choices. And so we have to commit to ourselves, our own health, commit to our families, our communities, and our nation. And again, it's our patriotic duty to do so. The time is now.
Well, we thank you for your time and all of your meaningful work, and for sharing all of this with our audiences.
Thank you so much for having me.
Absolutely. Good to see you again, Doctor. Be well.
All right. Take care now.
Bye-bye.